Care session. We're really happy to have you here today, and we're looking forward to a very exciting event today. This event will be very interactive, so we really encourage you to hang on to your seats. To kick us off, we are going to start with some really quick housekeeping items. To keep of note, please be aware that this session will be recorded. If you are attending remotely, please be sure your Zoom microphone is on mute. If you have audio issues, please join by phone. Be sure to mute your phone as well. And please type your name and affiliations in the chat, as George has prompted us to complete, and use the chat for comments and questions throughout the session today. Check your name and your pronouns in your name to ensure that it reflects you. Right, and for our next introduction here, we will provide an overview to ACE's Aware Kings collaboration. In addition to inviting our partners, leadership partners to introduce themselves, as well as provide a short description of their role within our network. ACE's Aware Kings collaboration, with funding from ACE's Aware, is a collaboration of Kings County Department of Public Health, California Health Collaborative, Kings Partnership for Prevention, and Kings United Way. With a second network of care grants, our collaboration has now extended to include Adventist Health, ARIA Health, EMT Associates, and Family Health Care Network. We also still have the support of our community leaders, such as Kings County Department of Public Health and First Five within our second grant. We very much appreciate the work of all our partners who have been committed to moving this work forward to improve the health and well-being of individuals, families, and the communities in which we live. Now, I would like to give our partners the opportunity to introduce themselves and briefly describe their role within this collaboration. And as I missed to mention, my name is Linda Baggio. I am the program manager for the ACE's Aware project with California Health Collaborative. And now I would like to invite any of our partners, our leadership partners, to please unmute yourself and provide an introduction to your organization and your team members. Thank you.
Good afternoon, everybody. My name is Erica Lopez. I am the 211 coordinator at Kings United Way.
Good afternoon, everyone. My name is Alexis Terrell. I am the community engagement manager at Kings United Way.
Good afternoon. My name is Karina Casares, and I am the office administrator for KPFP.
Good afternoon, everyone. My name is Cameron Jones. I'm the communications coordinator for KPFP.
Good afternoon, everybody. I'm Shannon Tolbert. I am the Health Homes Program Manager with ARIA Community Health Centers in Kings, Fresno, and Tulare County.
And good afternoon, everybody. My name is George Agatic. I'm the Training and Engagement Facilitator at the California Health Collaborative.
Good afternoon. I'm Leticia Espinoza with Adventist Health. I'm the Grants Manager, and Adventist Health in Kings County, we're helping support to get our providers ready to screen and then also to refer to resources.
Hi, this is Carson Gordon. I'm with Family Healthcare Network, and I am the Grants Manager Coordinator. And Family Healthcare Network is providing medical services for ACE screening to the Kings County community. Thank you.
Hi, everyone. I'm Mallory Badagan, Director of Special Programs, also with Family Healthcare Network.
Hi, this is Everardo Legaspi. I'm a Program Manager with the Kings County Department of Public Health.
Thank you so much, partners. I truly appreciate your introduction. And at the end of the session, we will give our community the opportunity to also introduce themselves so we can see who is in the room with us today. And as mentioned, my name is Linda Baggio. I will be your facilitator today. We'll also have our teams available on chat So if you have any questions throughout the duration of this event or any comments, please feel free to interactively utilize the chat for communication. Our agenda for today is as follows. We've covered our welcome, and our next parts is to discuss community leaders within this organization. We will also have a short Mentimeter break. We will cover the Trauma-Informed Network of Care Assessment Tool, which is the main guide for our discussion today. And we'll also offer some community discussion as well as tying some service goals to end our session. During our presentation today, I will request all of your participation for engagement using Mentimeter. If you are accessing this meeting on your computer, we recommend that you use your cell phone for active engagement. Please leave the screen open for continuous access throughout this event. All partners and community attendees are encouraged to participate during these Mentimeter sessions. Please navigate over to menti.com and use the code 18709654. Our first question is simple, and it just seeks to know where our community is currently. So the first question just is very simple, is how are you feeling? Please let us know how you're feeling by logging into menti.com using the code on the screen, 18709654, and let us know how you're feeling. We're already getting some responses. Some people are feeling great, some tired. Resilient, Monday feels. I love that. Positive, awesome. Excited, I'm excited too. We're getting a lot of tired. So you will see how interactive Mentimeter is, but the words that are most used will be most bolded. So now we're feeling a lot of people who are feeling tired today. Hopefully I can wake you up with today's content. We have awesome, great, hot. The weather is heating up, optimistic, good, sluggish, glad, great, glad to be with you. Thank you so much, everyone, for your response. See, we're having some more coming in. Content, blah. All right. And now I will close the voting, but we truly appreciate everyone who has participated in our very first question. And as mentioned, please continue to utilize your Mentimeter as we will continue the interaction throughout today's event. Now navigate back over to our presentation for today. I would like to share this video with you all. The contents of this video provides an empowering message that ACEs and their consequences can be prevented. And before I continue onto this video, I will stop my share and reshare just so I can share my sound.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need, and just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families, by changing social norms to support parents in positive parenting, by providing quality care and education early in life, by enhancing parenting skills to promote healthy child development, and by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Safe, stable, and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
Right. This video always makes me so emotional because it really does capture the power of community. As I watch this video, I reflect to my life in several communities that I've lived in, I've been a part of. And just to be a part of this project also equally makes me emotional as we're able to really see the deserving of so many community members in their experiences and helping to address ACEs. Apologize for my emotional response to this video. Every time it moves me so much. The ACEs Aware Initiative is focused in our state's effort. I'll go back to the slide. The ACEs Aware Initiative is focused in our state's healthcare system on healing the negative impacts of ACEs and toxic stress. By screening for ACEs, providers can better determine the likelihood a patient is at increased health risk due to a toxic stress response, respond with trauma-informed care, and unlock the potential of the next generation. This video that we just watched points out a community-wide action to preventing ACEs and providing buffering supports to children, families, and adults. And now I'd like to navigate us over to Mentimeter to answer some questions. This next question seeks to know, how did the video make you feel? So again, going on to menti.com and using the code 1870-9654, please provide a response. So as you answer this question, I will also invite you all to think, how can we integrate our services to provide referral supports to families in our community here in Kings County? I would like to encourage you to please unmute yourself and provide feedback on this video on how it made you feel motivated, because we have 13 participants today who are feeling as motivated as I am right now. So if you're feeling compelled, please feel free to unmute yourself and share how this video made you feel and how we can integrate our services to provide referral supports.
This is Teresa. And, you know, it's funny, Linda, that you say how this video makes you feel emotional. I've watched a lot of these videos that are similar to this. And I always think of the saying that says, but for the grace of God, there go I. And I really honestly feel that it takes so much more than just your personality, your gumption, your personal motivation to get you out of the neighborhoods that many of us grew up in, to get you out of the lifestyle that we saw some of our brothers and sisters fall into. What made me different? What made me not a drug addict? What made me not homeless? What made me not a high school dropout? What made me not, right? A lot of times I've asked myself that because I've seen this repetitive damage done to people I grew up with. And so now knowing that ACEs is bringing this to the forefront, the knowledge, the money being invested, all of that makes me so much more hopeful, because I think that if maybe I was one of 20, maybe in the next generation, my children will be the 10 of 20. And maybe my grandchildren will be the 17 out of 20. And maybe their children will be the 20 out of 20. I really think that this can be beat by knowledge.
That was beautiful, Teresa. Thank you so much for sharing. Truly appreciate your voice in this movement. And as you mentioned, everything you've mentioned also holds dear to me, and I am in full agreement. So thank you. And thank you so much for being part of this network of care.
For me, this is Mallory with Family Health Care. It just makes me think of the saying, it takes a village. So really that it takes each of us doing our piece to make a difference in someone's life. And we may not specifically know like whose life we may make an impact on, but that person will remember it, you know, for the rest of their life.
Thank you so much, Mallory. And we could take one more feedback if anyone else would like to share.
Hi, this is Sarah Flores with West Care Adolescent Services. And working with the youth, I have pretty much come to the realization that they feel a lot safer when they have someone that they can talk to and someone that's non-judgmental. And there's a lot of things that they don't feel comfortable talking to their own parents about. And if, you know, I know that I probably won't change everybody, but if I can help someone find a better path for themselves, it's, you know, kind of what got me into the position I'm in, is to because I have a passion to help youth. And it's kind of like just a little personal side is if I can help a youth avoid a path that I went down, you know, just from experience, then it's well worth it. And so I have seen a few lives change, and that in itself is a blessing. So I appreciate this.
Thank you so much, Sarah. Your voice truly matters in this work, and we truly appreciate you for making such a huge impact on our youth today.
Hi.
Right. To provide understanding to the functioning of this network, ACEs Aware provides a definition to what a trauma-informed network of care is. As you see on the slide, the definition is as follows. A trauma-informed network of care is a group of interdisciplinary health, education, and human service professionals community members, and organizations that support adults, children, and families by providing access to evidence-based buffering resources and supports that help to prevent, treat, and heal the harmful consequences of toxic stress. We might not immediately see how our individual health centers and organizations provide buffering supports. However, as we process the information provided in this meeting, we would like you all to take a look at the Stress Busters wheel right on the screen and think of this work as a machine. Where do you think you come in? Where do you think your clinic comes in? Where do you think your organization comes in? Each of our organizations add protective and positive factors as a community, which is part of the balance that makes this a community-wide work. We look forward to sharing with you today goals for expanding our trauma-informed network of care. We also hope to offer detailed information on our goals to incorporate an active participation of key holders into our network of care. The goal of our discussion today is to inform our community that the ACEs Aware Kings collaboration has completed an ACEs Aware readiness assessment, and the results are being used to set goals for strategic implementation of ACE screening and trauma-informed care into our practice. The readiness assessment provides an ACE-aware first guided step to being a trauma-informed network of care. We hope to provide a summary of goals and action items identified from the assessment in efforts to make this a true community-wide implementation. As you can see on our screen, the visual above illustrates the progression or continuum on which networks of cares are measured for purposes of ACEs Aware initiative. Network of care, round 1 and round 2. The reason why I use the word round 1 and round 2 is because we have been given 2 grants on their ACEs Aware initiative for Kings County. Round 1 and round 2 partners, Kings County Department of Public Health, California Health Collaborative, Kings Partnership for Prevention, Kings United Way, Adventist Health, ARIA Health, EMT Associates, and Family Healthcare Network have come to a consensus on the assessment levels for the community as a whole. We hope that the results of the assessment tool that we provide to you today would assist our community in developing goals for how individual organizations and partners will work together to advance the maturity of our network of care. For each question presented within this assessment, we selected levels 1 through 5 that best represents the Kings County community. We have determined that the Kings County assessment level as a whole puts us at a level 2. What this means is that as a county, we have some ACE screening experience. We have limited to no clinical protocols for interruption of the toxic stress response, and a community structure has not yet been formalized. We hope to utilize our current network of care planning grant to expand the creation of a continuous, robust trauma-informed network that flourishes beyond the grant cycle. This will require us to build a fully functional trauma-informed network of care, establish a shared accountability and governance structure, routinely utilize clinical and community interventions to interrupt the toxic stress response, build strong community provider relationships that will exist with feedback loops, and fully utilize a bidirectional IT platform through our Kings Referral Exchange program. We are in need of a collective community effort to improve our readiness. We will now dive into recommendations and strengths identified during our review of the assessment. In respect of time, the assessment information has been consolidated and action items has been provided to support the gaps that we've identified. And at this moment, I would like to ask if there are any questions in the room regarding this assessment tool that we will be diving into. I'll progress to the next slide. ACEs Aware recommends that all team members take a certified ACEs Aware core training, read the resource materials provided by ACEs Aware, and create plans to receive continuing education and training on the science of and health impacts of ACEs and toxic stress, as well as the principles of trauma-informed care. Our collaboration has developed a guideline for taking the Becoming ACEs Aware core training and have worked to provide repeated live and recorded clinical and non-clinical training presentations, which would hope that our community organization team members will utilize this resource as continuing education to grow their understanding and knowledge about the science and health impacts of ACEs and toxic stress. Training information for our non-clinical and clinical trainings can be found on acesawarekings.org and on the acesaware.org website. The core training provided by ACEs Aware Initiative can also be found on the acesaware.org website. I will be linking these right now on the chat. Community-wide demonstration on the understanding of the ACE and health impacts of ACE and toxic stress and providing trauma-informed care will elevate our county to a level 5 as described in the previous slide. Steps to training has been identified as taking the Becoming ACEs Aware training in California, which is a free online training that provides 2 continuing medical education credits and maintenance of certification for MLC credits. The training educates providers and the community about the importance of incorporating ACE screenings into their clinical practices. It also provides information on how to conduct ACE screenings, how to use clinical protocols to determine treatment plans, and best practices in providing trauma-informed care. The training is case-based and offers cases for pediatric, internal medicine, family medicine, and women's health providers. Although this training is geared for providers, it is very essential foundational knowledge for the community, for persons like you and myself. After taking the Becoming ACEs Aware training for California training, medical providers must attest to have completed the training in order to qualify for Medi-Cal payments for qualified screenings. We recommend that when completing the self-attest form, providers should check the option to be included in a directory of Medi-Cal providers for Kings County, as this will help Medi-Cal patients in our area to find ACEs Aware providers using the attested directory. The community assessment tool that we also completed points out the urgency for regular ACE screening and recommends the use of tools to set protocols for implementation, such as the ACE and toxic stress risk assessment algorithm. It offers, it also identifies value in referring patients identified with an ACE score to community-based services when needed. ACEs Aware recommends that organizations define clinical roles and team member tasks in support of developing ACE screening and clinical response workflows and protocols. They also recommend the utilization of the clinical workflow provided as a resource under acesaware.org by applying the ACE and toxic stress risk assessment algorithm that includes information on assessing and interrupting the toxic stress response, developing a care plan for the patient, and coordinating and documenting bidirectional referrals to community resources. This information that I'm reading out to you is provided on the Network of Care Roadmap, which is identified on page 27 to 29. One of my team members will be providing a link to the Network of Care Roadmap for your access. Outreach to expand the Network of Care to include representation of required buffering supports and services to support patients. Tying in all our services together will help to allow for active referral of patients to community-based and social service organizations when needed. This will require action from us to integrate our services in a bidirectional IT platform, which we have identified for the cases of this initiative as the King's Referral Exchange Platform. We need your support in ensuring efforts made to this project are measured, evaluated, and documented. We have a long way to go, and this is the start of action. We have set the goal to actively evaluate the effectiveness of our approach and make improvements in response to the data gathered. ACEs Aware recommends collecting data and evaluating outcomes that demonstrate our effectiveness. Evaluation requires the use of PDSAs defined as the plan, do, act steps for quality improvement. Following the PDSAs provided in the Network of Care Roadmap, which has been linked, will aid health organizations to improve clinical quality improvement goals and measures. ACEs Aware recommends the use of PDSA cycles to sustain improvements to the ACE screening and referral process. It also recommends regular planning and executing incremental tests of change based on knowledge learned from the current PDSA cycle. Lastly, they recommend an ongoing clinical quality improvement cycle on a regular basis and ensuring evaluations conducted on the effectiveness of interventions that we incur, which includes collecting data and evaluating outcomes that demonstrate our effectiveness. In summary, the utilization of PDSA processes will help to assess the efficacy of evidence-based buffering services and supports to build on success and make our network of care stronger. If you have any more questions about how to implement PDSA cycles in your organization, please let me know. We're also fully available to meet with you on a secondary opportunities to discuss with you over Zoom or over phone call as well. As community leaders in the ACEs Aware Initiative, we are dedicated to this world and hold ourselves accountable. In order to serve as a robust network of care, it is valuable for our network to implement shared accountability. This is a governance structure that offers feedback loops and a plan for how to achieve network of care goals. We hope to advance a recognition of this work needed to accomplish the shift of thinking and actions related to the science of ACEs and toxic stress, and the fact that toxic stress is a health condition that is amenable to treatment. ACEs Aware encourages a network of care that collaborates across systems and shares best practices related to implementation of strategies that will help reduce toxic stress as a health condition with other communities. We hope to work closely with our community to define and develop shared accountability. This will allow for each of our organizations to know where they come in and how you all can commit to this work, the machine like we described initially in the beginning of this presentation. Accountability requires a formalized structure and the creation of creating a mission, vision, and agreed upon goals and measures. We hope that over the next several months, we'll be working with you to develop a long-term mission and vision amongst our network. Our network of care is not currently integrating ACE screening, results, and workflows into the referral exchange platform. However, we are recommended to create visions for shared accountability to accomplish this. We hope that community members who are here today will join us in action and be added to the leadership and accountability structure in carrying out this goal. After an accountability structure has been identified and created, we aim to work with our community to implement processes, policies, and practices. We are aiming to support the development of screening and referral protocols for clinics. We also aim to support the creation of processes that aim to share best practices for incorporating prevention and treatment for ACE-associated health conditions into clinical protocols. In addition, we aim to measure the effectiveness of our approach to providing trauma-informed care and self-improvements to policies and practices on a regular basis as needed. We have been provided, under the Network of Care Roadmap, we have been provided actionable steps that health care providers, clinics, community-based organizations, and social service agencies can take to develop and implement a robust trauma-informed network of care in Kings County. The Network of Care Roadmap outlines key milestones for healthcare providers and clinics, as well as for communities, in a specific and actionable manner that can be applied in a variety of settings and contexts. Milestones are stated on the screen, are provided by the assessment tool as well. They're elaborated in the assessment tool. And more information on how to achieve milestones stated on the screen is also found in the Network of Care Roadmap, page 41 to page 65, which lists out milestones for providers, and page 66 lists out milestones for communities. Now, I would like to open the room to the community to please provide interactive responses to the milestones stated on the screen. If your organization is already working towards implementing these milestones, please communicate so. And if you see yourself falling into line and completing these milestones, please feel free to discuss.
Well, Linda, I'll start again. This is Teresa Alvarado. Currently, Aetna, the national company, is very invested in ACEs. And the trauma care centers is a movement that they are very much invested in as well. The unfortunate thing is that in the Central Valley, we currently have no membership. And so there isn't a huge movement to bring that about at this moment. However, one of the reasons why I do attend as many ACEs meetings as I have time to attend is because should we in the near future become a Medicaid provider in the Valley, then it will be something that we would integrate is the word I want to use, integrate into all of our delivery services.
Thank you so much for sharing, Teresa. I truly appreciate your feedback. Any additional comments or response to Teresa?
Teresa, I'm just wondering, are you aware of any movement politically that will allocate funds, not just for Medi-Cal providers, but for other insured?
You know, I'm going to say, George, that as the Medi-Cal world turns, so does the insurance world turn. You know, a lot of times, you know, we think about Medicaid as being for people who are, you know, just, you know, poor, and therefore people think that because it serves poor people, that it isn't as good as employer coverage. I think that if we really look at things, it isn't that Medi-Cal benefits aren't as good as private insurance. The problem is the network, right? It's that doctors are paid, hospitals are paid a fraction of what a private insurance pays for these patients. So, but a lot of times the changes that we see become or come through Medi-Cal, because there are a lot of people who are saying, well, if Medicaid can have X, Y, and Z, why can't I, as a private pay person, have X, Y, and Z? So I believe that as the world turns, like they say, as California goes, so goes the nation. I say as Medi-Cal goes, so goes Medicaid, so goes insurance. I believe that there are going to be opportunities when we see how successful it is to address ACEs. If it's successful in Medicaid, Medi-Cal, it will be successful, and I think it will be replicated in other places. But personally, I don't know of any private insurance company or what Aetna's efforts are beyond Medicaid.
And I'd like to open that up if anybody else has heard of any Senate bill that is currently in the works or is in process that will provide for coverage for ACE screenings for private insurance companies.
Hi, George, this is Shannon. I haven't heard anything, and I try to keep pretty up to date on that. But then again, it could be that COVID and vaccines are definitely the primary topics on most of the podcasts that I listen to that deal with healthcare and health policy. So I'm wondering if it's not that it's not happening, it just might be eclipsed by bigger stories right now.
Thank you so much, Shannon and Teresa, for your contribution. And thank you so much, George, for helping facilitate that conversation. Exposure to abuse, neglect, discrimination, violence, and other adversities and other adverse experiences increase a person's lifelong potential for serious health problems and engaging in health risk behaviors as documented by the landmark Adverse Childhood Experience Study. Because of the ACE study and other subsequent research, we recognize that exposure to traumatic events, especially as children, heighten the health risks of parents long afterward. We also know that there is hope. Toxic stress is amenable to treatment. We can change and save lives. We can screen for ACEs and toxic stress risk, intervene early, respond with evidence-based trauma-informed care, and significantly improve the health and well-being of patients. Our community grows aware of trauma's impact. And as we grow, we are realizing that this impacts everyone in our community. And we are also understanding the value of creating trauma-informed network of care. Your network of care leaders aim to build awareness regarding the impacts of ACEs and toxic stress in the community. And we also aim to do so with your support. Therefore, we're inviting you all to please journey with us to save lives by playing a significant role as a community leader towards this initiative. Arm in arm, side by side, we can prevent and address the impacts of and treating ACEs and toxic stress. Together, let's reduce California ACEs and toxic stress by half in this generation. Through the Network of Care Roadmap, we have now acknowledged a full list of organizations, entities, and provider types that are key partners in an effective network of care. We have developed a resilience tracker to guide our community. The resilience tracker, as you see on the screen, aims to help our Kings County community to clearly see where our progress is in building a robust trauma-informed network of care, as well as our gaps in representation. We aim to continuously track this resilience tracker as organizations integrate into our network of care. In the next coming weeks, it's important that we focus on who needs to be here at the table. How can we support each other to meet these milestones that we showed and discussed? And what resources would help us succeed in our role? All efforts made will prepare Kings County to actively begin screening for ACEs and navigate patients to necessary referrals. We would also like the opportunity to collaborate with our community to identify future funding needs and secure financing that would help our network of care thrive in the future. So what partnerships do you currently have that can help push this work forward with financial support? What partners do you have that can support the referral and screening of patients? I would like to take us to a Mentimeter to discuss this in an interactive shared screen. So before we begin, I would like to know, please navigate over to your Mentimeter screen. I would like to request your participation with completing 4 questions. Your responses will allow me to gauge what sectors are represented today, in addition to what the readiness of our organizations and attendance are. So if you could please respond to the screen stating which sectors are in the audience with us today. They're a little hard to read and I really apologize in advance. But the statements provided are primary care providers, behavioral health providers, schools and education, early intervention services, social service programs, local, county, and government programs, tribal organizations, legal justice system, managed care, community-based organizations, faith-based organizations, digital health organizations, and others are also welcome as key stakeholders. So please identify yourselves by just clicking on one of those responses. And if you don't fall into those responses, please feel free to click other. So far, we have 12 participants, and I know we have more than that in this call. So please, I encourage everyone to please click on. I also highly encourage our partners to please participate in this as well, as your participation is part of this movement. So right now we have a high attendance of primary care providers in our setting today, followed by community-based organizations, local and county government programs, and managed care. So far, we are seeing a gap in representation of behavioral health providers, school education, social service programs, not on the table currently today, tribal organizations, local justice system, faith-based organizations, and digital health platforms. Would anyone like to respond to the outcome of this voting right now? Where do you think we can work on to increase the attendance of those who are not currently in the room? In addition to increasing those who are in the room, because they are also our key stakeholders. Please feel free to unmute yourself and respond.
Linda, through the Kings Partnership for Prevention, we have a, Katrina, help me here. Karina, not Katrina. Is it there's two work groups that I say might be able to feed into this. Is it the substance abuse group that that has West Care there? Well, West Care is here today, aren't they? I'm trying to think of, and the county is here today too. I take it back, have no idea.
And also, Alexi pointed out that it's important to note some of the organizations may fit into two categories, one or two. For example, addictions can be behavioral health and primary care. So you have to understand, pick the one that is the most valuable to give us an answer, a response on this one.
So then I guess for us at West Care, we have behavioral health, but we're also community-based. So it kind of does fit into a couple of categories.
Thank you so much, Sarah. Right, and we will navigate over to the next three set of questions. And these questions will seek to know where our community currently is in a trauma-informed movement. So the next question asks, all team members have taken a certified ACEs aware core training and read the resource materials. So how many of us in this room today have taken the ACEs aware core training and accessed the tools and resources provided by ACEs aware initiative? So far we have 2 yeses. This is looking good so far. We have 3 yeses, 4. Let's get that to 26. We have 7 yeses, 7 people who have taken, okay, we have 1 no, that's okay, 2 no's. We'll get you up to that yes by the end of this week, I promise. Thank you so much, everyone, for their participation. I'd love to see it. I'm seeing that a lot of the members here today have taken the ACEs Aware core training and have read the resource materials. This is really wonderful. That is the first steps to learning about this work and becoming ACEs aware to truly impact the goals to moving forward in screening and referring and providing services to the community. 10 yeses, that is awesome. That brings so much joy to my heart to know that so many of us in this room today are ACEs aware.
And Linda, I think it's wonderful to see so many that have responded as yes, but I'm just curious right now, for those of the 4 who have responded no, what would be the biggest hurdle for you in terms of taking a core training or being able to do that? I'm just wondering if you could unmute yourself and just share a little bit about why you may not have taken the training already, or why you feel it would be, and I'm not sure, but go ahead and put it out to us and let us know what's your biggest hurdle in taking the core training.
I'm going to retire in 6 months, so I don't want to have anything else in my arsenal. I come to the meetings, I participate, I learn as much as I can, I've actually gone to the training, but I haven't been certified because I don't need the certification for my job. So that's the reason why I'm not certified, is because really, I mean, I'm retiring in 6 months, you guys.
Congratulations, Teresa. I think that's wonderful. And just to clarify, in terms of the word certification, it's really just, have you taken the core training, not necessarily certified. Those who have attested to have taken the core training are generally those that get Medi-Cal reimbursement. So if you've taken the core training, it's simply a two-hour commitment to take that training. It's a very, very good training. They use case studies, and they cover the gamut of ACEs, toxic stress, and resiliency. So I'm curious, is there another person? I see 5 people here who have not taken the training. What would be your biggest hurdle to taking the training?
Hi, George. This is Liz with Calviva Start Smart for Baby program. I would actually be interested in taking the training. I just haven't been presented with the opportunity yet, but I think it would be very valuable to our program, as I'm sure ACEs has a lot to do with unplanned pregnancy and things like that. So I would definitely be interested in receiving that information.
That's excellent. Thank you, Liz. I really appreciate that. Yeah, we definitely can get you that information. In fact, one of our team members in the chat feature will put where you can find the training in acesaware.com. And it's so easy. Literally go to the website, click on take the training, and buckle in for a couple hours and of very, very interesting material. And the core training is really the gold standard of trainings. I encourage everybody to, as Linda has said, to take that core training. So know that the core training is different than our supplemental training. Our supplemental training is ancillary to that core training. So what we're doing here is we're really underscoring the importance of that core training and allowing us some time to think about what are some of those things that hold us back, because it shouldn't be. It is a very simple way to get there, to get to the website, to take that training, couple-hour time commitment for a gold standard experience of finding out and being educated around ACEs, toxic stress, and resiliency. Linda?
Thank you so much, George. And I'm just so curious to add to that. Those who have stated no, hopefully we can move you to this planning phase. We have provided the links on the chat, and we can move everyone to the planning phase to eventually the next month, as we restate this question again, we can have all yeses. Let's empower each other to be a part of this work and help impact greatness in our community. And the next question is, our organizations are currently screening for ACEs or supporting an organization that does. So we understand that every representation here might not be clinical, might not have access to viewing the screenings and providing screenings to patients. But if you're supporting an organization that is moving towards this effort, please click yes. There's also an option to click no, unsure, or currently in the planning phase to apply it. And as always, if you would like to unmute yourself and share your response to where you are, we would like to encourage you to do so. So far, we have 6 yeses, 6 organizations that are currently screening for ACEs or supporting an organization that does, 4 that are in the planning phase, and 1 that is unsure.
Those are all positives. There's not one no in there. So it's great to see that people are on that movement toward ACE screenings and supporting organizations that do. So there's nobody here that is not doing that as a definitive negative. This is really, really exciting information here, really good news.
Absolutely. And would anyone like to unmute themselves and share? You could share how your organization is currently screening, or how your organization is currently supporting, or how you are in the planning phase. We would like to hear from you, our community. So please feel free to unmute yourself and share. All right, and if there are no responses, I will move on to the next and last question. 9 yeses. This is growing. Awesome. Right. For our last question here, our organization actively practices trauma-informed care, is reducing implicit bias, and provides care that is culturally appropriate for all. 3 yeses. People are jumping on this. 5. This is amazing. 1 unsure. Right, this is looking really good. Awesome. I'm really, really happy. You know, I'm getting so excited and yet so emotional to just see all these positive responses on the active practicing of trauma-informed care and reducing implicit bias and providing culturally appropriate care. In the next coming months, we will be discussing how to create these protocols and policies to help improve these processes and also support your organization in creating these policies. So I really look forward to knowing that so many in the room are already there and can provide multiple feedback to help aid the conversation that we will have in the next coming months. And for the person that clicked unsure, if you feel comfortable to, how would you like to share? Or those who clicked yes, please feel free to share how you are actively practicing trauma-informed care.
Linda, this is Liz with Calviva, Start Smart for Baby. So we do have our own questionnaire system that we use along with care plans that we generate based off the members' condition and problems that they report. But we have our own assessment and screening for behavioral health concerns. And a lot of times there is a lot of perinatal and postpartum depression that's related to trauma either before the pregnancy or during the pregnancy. So we do refer them on to our behavioral health department to get some further assistance for those concerns.
That is wonderful, Liz. Thank you so much for sharing. And thank you so much all for participating and responding to our Mentimeter. Questions covered will help guide the facilitation of our network of care in the next coming months. If you have any additional questions about the questions asked, I encourage you to please reach out to me via email or any one of our team members. I will ensure, George, if you could please help me include my email in the chat, because this is a conversation to keep going, not just towards one session. So I highly encourage the connection to continue. Now we'll continue with our presentation. So at the end of each session, we plan to ask, now that I've attended, I have attended, what now, what's next? We hope to ask this question and answer it as well at the end of each event to ensure that we're presenting the right information and engaging local and regional leadership and offer action items that will help bring you into this work as leaders and partners into this work. So we've created a membership form for our network of care. We're asking that you please complete our membership form, and I will link it into the chat right now. And I encourage you to click on this link right now and take a look at it. And hopefully complete it as well. The goal is to complete the form. When you complete the form and your organization name is entered in our membership, we're able to include you on our website as part of this network of care. We're able to join you in action, and we would like to encourage a membership composition that includes identified key stakeholders, people of color, individuals with lived experiences, patient, parent, family representatives in our network of care structure. So if you know a partner who should be included in this network today, they're not here today, please we ask you to forward the link over to them, because this membership will serve as your organization's pledge of support towards this effort. A pledge that serves as a commitment of time and energy dedicated to this work, which will help to legitimize our work within traditional and non-traditional settings. Please note that as a network of care member, we ask that you please join us to complete basic tasks that may be estimated to take an average of just 5 hours or less a month. Community members are welcome and encouraged to do more in support of the ACEs Aware initiative. However, additional activities are not required. Community members will be recognized for their service towards moving towards this initiative on our acesawarekings.org website. The ideal network of care member is noted in our full list of key stakeholders. They're committed to ensuring that his or her organization is informed and trained about ACEs aware and trauma-informed practices. They're willing to serve as champions for their organization in applying cultural sensitive, trauma-informed approaches to communicating about ACEs aware, connecting your organization to resources and knowledge shared in this network of care session, our peer-to-peer sessions, and our provider trainings. When requested, and generally, they are also part of supporting the ACEs aware collaboration to create protocols and policies, as mentioned, towards trauma-informed care systems that support ACE screening and implementing trauma-informed practices in our community. Our network of care, as a network of care member, we also hope that you're dedicated with us in fulfilling the Community Champion Award checklist, which will be released soon to our community in the next coming month. We're creating a resource document for Kings County. This is going to be a toolkit that guides our community to action. It will also work, it's been issued by our current ACEs Aware Kings Collaborative, and it will include action items such as completing the Becoming ACEs Aware training, as we know that a large amount of us in this setting right now have completed that training. So you're already meeting those needs. Completing a program that we've created, which is the ABC worksheet, which is assess, break down, and connect your services to be a part of this movement. As you assess your services, it allows you to assess the services that you might be able to provide to the community. Then you're able to break down your services by either stress buster intervention or toxic stress mitigation and social service. And lastly, connecting your services to their appropriate stress buster intervention and communicating it within this network of care. We also hope that all this efforts helps to connect and engage our community towards this initiative. So we please request your attendance and your continuous participation in our network of care, as well as your action to complete this form. Now, I'd like to ask if everyone would like to take a couple of minutes to complete this form, or if you would like us to continue. We do have the time to give everyone a break to take a look at the form, because I do want to highly encourage that action to complete in the membership form. So what are your thoughts, community? Would you like a minute to complete this form, or would you like us to proceed with the items for today? And as mentioned, the forms, it's linked in the chat. And just to show you all what it looks like, it requests your name, your phone number, your email address, organization information, what sector best represents your organization. It also covers a pledge to be part of this movement with us. And by no chance is this pledge a full commitment. It's just that you're agreeing to be a part of this important work, and you're willing to put the time in to be a part of our network of care monthly activities, as well as the action items mentioned. We also requested some voluntary demographic information and lived experience to get to know our community better, to see who is on the table with us. We also have a section where we request for you to share your story, whether you're personally impacted by ACEs or just any story you would like to share about your experiences with servicing a community member, a client, or a patient. We ask that you share. Finally, there's some optional questions as well on if you would like your name information published on our website as you complete this form, if you're interested in learning more about our King's Referral Exchange system, and also would like to know how you heard about this network of care. Maybe you encourage your partner to attend and they would like to share that information. We want to know, because we would like to understand how to best serve you all. We also provide an option to schedule a 20-minute orientation meeting with one of our team members. This is very optional, But if you're interested to learn to give us more knowledge, as we are so much excited to learn about your services, what you're currently doing in the community, and you would like to know how to integrate that work with what we're doing, we highly encourage you to please schedule a time with us, something as short as 10 minutes or 20 minutes. And with the COVID-19 adjustments, connecting via Zoom has made it so easy for us to network. We also ask that you please partner with us, attend our training and education opportunities, join our referral platform, screen, refer, and network with us. And almost here to the end of our discussion before we encourage a community integration of communication, I would like to turn this over to Karina to please share with us a wonderful assessment of a community video that is coming soon to Kings County.
Perfect, thank you. So for this video that we are wanting to create, this is kind of a first look for the community to see which organizations are on the forefront of this ACEs movement. And so, you know, first of all, we want to educate the community on ACEs, either just the basics of what ACEs are, the importance of it. We even have some statistics on how this is pertinent to Kings County specifically, but we really want to also show which organizations are pledging towards trauma-informed care and building resilience in the community, because we want our community to look on these organizations and admire and appreciate the fact that you guys are doing this work. And so we have this idea to create it's about a 2-minute video. We have the script is approved and we're ready to move on. And as I said, it's a call to action and a pledge to build resilience in the community. But that means that we need you. And so what that means exactly is that if you guys are or your organization is interested in being showcased, and you know, you feel like this is something you want to do, you want to be that network of care member, you want to show the community that you're part of this movement, then we ask that you email either myself or Cameron. I've inserted our emails at the bottom. And what we would do is we would either meet with you in person or via Zoom. And of course, with COVID, we would be following COVID guidelines. But if any of you have gone to like the prevention awards, you know, we would go out and we would give you a script, a portion of a script that we would just want you to read. And once you read it, that's pretty much all we have for you to do. That's all we're asking. We will be then taking all of these videos of you guys reading that script, and we'll be kind of taking a word from this person and a statement from this person, and we'll be collaging it together. So I don't know if you guys have ever really seen more modern voting commercials where it's like the celebrities and each celebrity says a word and it's really powering and really, you know, motivating. That's what we're going for. So we might have you say just a couple words, we might have you say a statement, and then we're going to cut and paste it all together. But we really want to show the full diversity. So that's why we would love for all of you to be part of it, because the more people that we have, the more diversity, the more strength, and it just shows the commitment that's in the county. If, you know, we have all these community representations. So we would be asking you to contact us by April 28th, which is, I believe, next Wednesday, to say that you're interested, because then it would take us time to schedule with you, whether, like I said, we can do it in person or Zoom. It is an amazing platform, which if you cannot come in person, we can schedule a Zoom video session, and then we can press record, and then you can do your piece, and then we can edit that in. So that's also our second option. But we asked by April 28th because we want time to be able to also edit. And so April 28th at 12 p.m. Again, you can email Karina or Cameron.
And I think this is one way of really getting your organization connected in the community, doing a positive thing, establishing a connection to the ACEs movement, and all that being trauma informed is. I think what we're trying to do is get people to understand how important it is to be trauma informed. And if your organization is trauma informed, people will gravitate toward your organization because of that. Linda?
Thank you so much, George, and thank you, Karina. We here at ACEs Aware Kings Collaboration, we are so excited about this event of creating a community video assessment. And as Karina was speaking, I was visualizing our providers, our organizations, just communicating the message of partnership to help cut ACEs in half in one generation. That is big, that is huge. And we play a significant role. So joining that message into one voice is truly essential to help push this movement forward. This is a video that will last beyond any grant, beyond any financial support. So hopefully we hope to create a video that will continue to inspire so many minds. And I'm so excited about it. So I hope that as you complete your membership form for Network of Care, that you click on that section. Yes, please contact me to be a part of this community video announcement. It's not going to take a lot of your time to be part of a huge, phenomenal movement. So I hope you're all encouraged and motivated to be a part of it. You could be on via Zoom or in person, whatever you're most comfortable with. I personally am most comfortable in Zoom because I've been in the Zoom life for a while. So I will be making my video call to Karina via Zoom. So I hope that you could do the same in person or in Zoom. And
Linda,
Linda,
what this makes me think of, in our supplemental training, we have a slide that shows that Kings County is one of the counties that is noted for having the highest preponderance of people with 4 or more ACEs. This is significant. This is truly significant, and why we're doing this work, why it's so important that we're doing this work here in Kings County, because Kings County has a higher prevalence of people who have 4 or more ACEs. This is our population. This is our community, and we are trying to make a stand and drop those toxic stress levels so that people can live happy and healthier lives in our community. Can you imagine moving Kings County off of the map of one of the highest counties in California with people with 4 or more ACEs? If we move that off the map in one generation, that's our goal. We're really trying to establish healthy habits right from the start, dropping that toxic stress, having those avenues available for our community. And these are some of the things that get us excited, because it is about Kings County and about making Kings County a healthier Kings County.
Thank you, George. So well said. I am full support of your statement, and I truly appreciate you for connecting our conversations today back to where we are on the map. Usually, we all love to be recognized, but we don't want to be recognized for ACEs. And so now we want to hear from you all that are here. What are you currently doing in your organization to support the ACEs movement? Please share, provide any updates for your organization towards this effort. We want to hear from you. So I'll leave the room open to any community organizations, healthcare organizations who would like to speak. Thank you. And after these announcements, we will be doing a raffle. So we hope that you stay to hear what everyone is doing. And for those who are staying to the very end, you will be entered for an opportunity to win a raffle with us. Thank you.
So I'd personally love to share about the Got Needs survey. If you have not heard about it, we have a very, very, very important community needs assessment that has been going on for about 3 weeks, and this is our last week. And so what this community survey, why it's so important, is because any other survey can give you the numbers, of ACEs or the numbers of obesity, but we look at those numbers and we don't understand why they're so low. Why is Kings County, why do we have all this trauma? And this survey helps gauge people's perceptions. So it actually asks, what are the barriers to healthy eating? And then you realize that, oh, it's because people think they're already eating healthy and that's why they're not buying healthier food, or because there's not enough in the community, and they're not being able to reach it. And so this is a really, really, really important needs assessment for us to see what are the services in the community that are being utilized, what needs to be created, what needs to be promoted more, all of that good stuff. And this directly ties to ACEs in more ways than one. For one, it gets actual Kings County data. So either data relating to the actual ACEs themselves, or with the whole stress buster wheel and seeing which services are in the community, maybe we say, oh, we have all the organizations that meet the stress buster wheel, but if no one's utilizing them, then what is the strength of that? And so this survey gets that data, and we'll have that data. We've done this for 2 periods. We do it every 2 years. And so we have 2017 data, we have 2019 data, now we'll have 2021 data. So we have comparable data, and this is something that will continue in the future. So it's just a really great opportunity. And Cameron has put the link in the chat. Also, if that motivational statement wasn't enough, we have some great prizes. So every week we've been raffling a $50 Walmart gift card. So that's one of them. And then at the very end, we have 2 tablets that we are actually raffling off. So definitely not just yourself take it, but please share it within your organizations, share it with your clients. Just please share it. It's our very last week. And you can find all of that also on our website, which I will put the website link to, and you can find all that also. So thank you.
Thank you so much, Karina, for that wonderful update. That was very inspiring. And if anyone didn't hear that clear, not only is this good work, but you get to win stuff on top of it. Oh man. I don't do it for the incentives, but if the incentives are there, I'm going crazy. So thank you so much, Karina. Does anyone else have any additional updates on their work? We want to hear from you. We want to support you. So please let us know. Unmute yourself and speak up, community.
Hi, so for our program, I'm kind of new in my role, in my position. I was one of the counselors for about 4 years. And so I'm kind of getting all the information. So right now I'm doing all the information gathering so that I can present to our director, who, kind of gives me some guidance on directions that we can go. So I'm really excited to hear that, Medi-Cal does cover, because we work with Medi-Cal recipients. And so I'm excited to see if we can expand and get our clients all the resources that they can use to better themselves.
Thank you so much, Sarah, for that amazing update. Thank you. Any other community members would like to share an update?
I noticed that there were some people who we are planning on doing the screening or supporting those who are screening. I'm curious, what are some of those plans? Where are you in terms of the screening? What part of the planning process are you in terms of moving forward in that area? If that can be something that you are working on here.
I know we also have some great partners in here today who have been doing this work with us. So if you would like to share any updates about your goals for accountability to this work, please take the time right now to do so.
I can jump in. I'm Carson with Family Healthcare Network. We currently are doing ACEs in Kings County, but right now where we're at is really trying to formalize our documentation and workflow, because really the end goal with that is being able to start drawing metrics and really start to inform our PDSA cycles with data rather than just making assumptions about what we hear from our providers during their ACE screening process. So that's where we're currently really working towards right now for us at Family Healthcare Network.
Thank you so much, Carson. Had a discussion with Carson last week, and he really did show me and discuss with me Family Healthcare Network's efforts with screening for ACEs and providing referrals. And we also spoke about so many opportunities to proceed with this grant. So thank you so much, Carson, for really sharing the efforts that you have been working on to help us accomplish our goals. And I think we have Lexi on the call. Lexi, would you like to share some information with us about how to integrate our services here within our network to help drive this work forward?
Sure, thank you, Linda. So I know many of you have probably heard about the King's Referral Exchange. Linda mentioned it many times. If you haven't heard about it, I'll include in the chat a link to get to a Unitas demo, which is the platform that we're going to be going through to create this referral exchange for Kings County. It is going to be a referral platform, but it's also going to be a information platform for those who are on it or interested in being in it. If we're working on the integration with 211 and would love input on that. And if you have any questions, feel free to email me. I'll include that in the chat as well.
Thank you so much, Lexi. And Lexi is a really great resource to help aid your organization or your individual understanding about the referral exchange, the King's Referral Exchange system. She can also provide information on how we can integrate our services as well as how your organization plays a significant role. Like we said, this is a wheel that it's like a machine. We all play a part in order to make it move forward. So it's important that you are able to identify which services your organization offers to help provide buffering, toxic stress, and social service support for our community. And Lexi can help make those connections for you. And if there are no additional comments, we will move on to the raffle. We have 5 minutes left, and that will allow us to complete this raffle and give you your day to enjoy. And please, I hope this session has created a lot of motivation to support your efforts towards this goal. I will now stop the share of my screen to Cameron. George, did you have a comment?
You know, I was just going to say, I think many people may not have thought about how their services are related to that wheel of stress, that stress buster wheel. And I think just to take a moment and to understand that your services, the things that you do to support our community does relieve a toxic stress, and connecting yourself to that wheel to see which area particularly that you are attached to in the services is part of what we are trying to do to get people to think, hey, I can help somebody by reducing toxic stress because I offer mental health services, because we offer yoga classes, or because we offer big brother services or big sister services. So it's a shift in how you think about what you do and the positive aspects of how that really helps people. And that's the connection we're trying to make there. So check in with Lexi and check in with the ABCs of what we're doing when we come out with our toolkit, which will help you walk through all these exercises.
Thank you, George. And now I will put it forward to Cameron to please share your screen and let us know our winner for today's event. All right, we have a winner, Sarah. Thank you so much. Is Sarah still here with us? Yes, she is. Sarah, congratulations. You are our grand winner for today. We appreciate your attendance, your participation in this network, and we appreciate everyone's attendance as well as your participation today. And we look forward to seeing you next month to continue our interactive conversation about how we can truly support our community. And we thank you so much for being part of this work and for creating so much positivity and encouragement and motivation in my heart today. Thank you all. And if there are no more questions, we will end today's session. But if you would like to stay back and ask any questions to our team, we will stay on till everyone exits the room. So thank you so much, everyone. And I wish you a great rest of your evening.